Many of the province's doctors are lashing out tonight against the health minister. He repeatedly denied making a comment that was recorded and widely circulated. Penny Daflos now on the unprecedented blowback at a time our healthcare system is already in crisis.
Family practices are shuttering, and it's taking longer to see a doctor as exhausted BC physicians cut back or walk away from long hours and unpaid work. So those still on the job were stunned to hear the health minister say when it comes to team-based primary care,
I really emphasize family doctor, nurse practitioner, because I think in nurse practitioners, I'm not saying they can provide better primary care, but for many people they do.
Because he says
nurse practitioners tend to take more time with patients.
In BC, government pays family doctors per patient, but they spend many hours each day doing compulsory paperwork unpaid.
It's disappointing, but I do think that there is an opportunity to educate.
The association representing all BC doctors was diplomatic, while the family doctors say
the minister has always confused nurse practitioners with family physicians. The health minister needs to spend more time with family physicians
and less time on divisive comments.
We're not going to solve the problem with healthcare by trying to play Peter against Paul.
Doctors on the ground are just as blunt.
It was a profound slap in the face to every family physician that is continuing to try to offer the best of care to our patients.
The avalanche of criticism from BC doctors on social media denounces Dix's comment as misleading, clueless, insulting, and devaluing GPs.
I actually said quite the opposite. My first line was, I'm not saying that.
Here again is the original comment.
Nurse practitioners, I'm not saying they can provide better primary care, but for many people they do.
When the opposition asked why he said nurse practitioners provided better care,
for many people they do.
I didn't say it. I don't believe it.
Doctors were watching across British Columbia, and their comments were based on what they heard, not what I heard.
After damaging an already deteriorating relationship with doctors, we should note the minister's final comment to journalists.
I don't think there's been a government in history that's been as supportive of family practice doctors. We got a lot of work to do.
And Penny joins us. Penny, doctors not pulling any punches tonight. This is a really unusual situation with the BC health minister so at odds with our province's doctors.
Well, especially Mijang, because everybody agrees that team-based care, where somebody can see a doctor or nurse practitioner or somebody else for non-emergency care, is good for patients and staff alike. But, you know, my sources tell me the minister is increasingly seen as playing a major role in poor management and bad morale that's impacting all levels of the healthcare system. This comment and his handling of it is really making things worse.